Hello, everybody. My name is Grant Way. This is my father,
Hello,
Dr. Way.
Dr. Way. Nice to meet you all.
On Zoom, we have Ethan and Jaw, and Natalie as well. So, I guess to start, who are you? Tell us a little bit about yourself.
Sure.
What is your profession? How did you get to where you are? And what is your business?
Okay, so my name is Dr. Richard Way, and I'm a physician, an excellent one, by the way. And I trained initially in Chicago. I did my residency at Northwestern Medical University. Then I did a fellowship at University of Illinois in Chicago for occupational medicine as well. And while training, I did a lot of moonlighting in the emergency room.
Mm-hmm.
So I have a broad background in the area that I practice.
Mm-hmm.
From Chicago, then I moved to New Orleans, and that's where I built one clinic to around 5 clinics.
Mm-hmm.
I also incorporated a helicopter service for medical injuries that were occurring in the Gulf of Mexico. And these were some significant injuries, from spinal cord injuries to huge lacerations to really significant skull injuries as well, from crush injuries. And so we would transport them via helicopter to the hospital that had privileges in, and I would be consulted and take care of these patients as well. Then from New Orleans, then moved to Bellingham, Washington, and I bought a clinic here where I actually increased the revenue and the patient volume by probably 3-fold in the last 15 years.
Wow.
And so what my practice consists of is urgent care, occupational medicine, sports medicine. We have a physical therapy clinic. We do basically everything in-house, from x-rays to blood draws to vaccines to audiograms to pulmonary function tests, etc.
Mm-hmm. Wow, that's a lot.
Yeah, it's a model that I created where you don't have to rely on outside sources, where there's self-referral within the clinic, and it's a model that works very well.
That's pretty cool. And so it's been over 25 years?
Yes, I've been practicing medicine.
Or like just ran your own organization?
Yes.
Wow, that's a long time. So I guess with your current endeavors at the clinic, how do you keep your team motivated? I know there's definitely difficult times. You guys went through COVID. That probably had a lot of challenges and setbacks, and motivation's very important. People start feeling down, doing less work, not being productive when motivation drops. So what are some incentives, or kind of how do you manage that motivation within your team?
Yeah, it's a great question. In terms of motivation, right? In my clinic, I kind of break it down into 3 different tiers, right? There's the professionals that work with me, the physician assistants, they're the providers. They're basically captains of the ship, and they're the ones that really lead the team in terms of motivation as well. So my job is to make sure that my providers are well taken care of, that they're paid a really good salary, and that they're bonused appropriately, right? So that's a motivation to stay with a clinic and to do as well as you can, and also see the patient volume. And then the other motivational things that I like to do is we hold team meetings at least once a week, where we lead them through what have we done that was really good, what have we done that was not so good, that needs to be worked on. And I reward my staff with free lunches if they see 80 patients or more. So that way, I always tell my employees that, busy is job security, but also busy means that you get lunches or you get bonus structures as well. So I find that that's a pretty good way of motivating my staff.
And then, so you're kind of, it's like a hierarchy of motivation, it seems. It's like you kind of head the main I guess PAs you're saying, and they start not managing and motivating and making sure that team stays up.
Yeah, so the way my clinic is broken down, right, is I have 25 employees, of which there's 3 providers, and each provider has a team that works with them. And so I want my providers to be the captains of the team and be responsible for making sure the patients get taken care of well, making sure that all the orders are done correctly, labs are drawn correctly, x-rays are done the right way, and to make sure that, most importantly is to take care of the patient, make sure the patients get the care they need.
Very patient or centered.
Absolutely,
Yeah.
Absolutely.
Wonderful. Ja, you want to ask the next question?
Yeah, how do you tailor your motivational techniques to different individuals on your team?
So starting at the front desk, right, I have a bonus structure for them that if they are able to schedule over 80 patients a day, that they get X number of dollars per month as a bonus structure. And this keeps them happy because they know that not only are they going to get busy, and if they keep the clinic busy, then they make more of a monetary reward as well. When I look at my billing office, I motivate them by telling them if they pull in X number of dollars per month, if they are able to keep up with charges where they're only 1 day in arrears, or if they work, over $20,000 a day in terms of accounts receivable, they get bonuses for each of those tiers that they hit. In terms of my nurses, right, they don't get a bonus structure, but they do get Employee of the Month awards, which equilibrates to cash, food, parking spots, and they seem to really enjoy that as well. And in terms of my providers, I give them a really good structured bonus where, if they're able to see X number of patients on a daily basis without getting overwhelmed and without treatment being affected, they're rewarded for seeing more and more patients.
Very cool.
So much incentivization. That's insane.
Yeah.
If you don't mind me asking, Dr. White, do you know if this type of incentivization structures in other practices similar to yours, or is it pretty unique?
I am not sure my bonus structure is equivocal to all other clinics. I do know that a lot of different clinics have different bonus structures. Some are based on what we call, RVUs, meaning that, based on a physician, if they, charge more, then they get more per patient. And I think that's the wrong incentive because I want, my clinic to do what's necessary, but not more than it should be. So that kind of runs the opposite way of what my belief systems are. Other structures are more penalty-wise. If you don't show up for X number of days, you get less pay and things of that sort. So a negative bonus structure, I don't think fits well with my culture as well.
Ja, want to ask the next?
Yeah, next question. How do you ensure clear and effective communication with your team?
Yeah, very important in medicine, right? Because it's an autocratic system, right? When we tell our nurses to do something, they're called orders, right? So basically the providers are the captain of the ship and the orders need to get done, especially if there's an emergent situation such as, say, a chest pain that walks through the door and there's a heart attack that we've diagnosed, and minutes count. And so when an order is given, i.e., we need 3 cc's of epinephrine, I need to hear from my nurses, got it, yes sir, I have it, so that I know the order is going to get carried out. If if I need 2 liters of oxygen, again, that needs to come from a nurse saying, I have it. If we're calling 911, I need to hear from the front desk, yes, we're calling 911. So it's a big feedback system, and that's how it works in medicine. You need to hear that response verbally, and that's how communication is done. So that's when there's like emergent situations. I'll pass it on to you fellas. That one of the best advice I've ever been given by one of my mentors is that in any emergent situation, the first pulse to check is your own, meaning that when chaos is occurring, you have to calm your pulse down so that you can see the picture of what's happening clearly and lead the team through a crisis.
Wow.
The other forms of communicating to my staff is, we do have weekly staff meetings, and we also have a monthly dinner that I treat the staff to, that we actually present issues that the clinic is going through and ask feedback from my staff members.
And then day to day, just from my experience, because I've worked there a little bit, Teams, like that's a great communication
exactly.
system.
Teams is a good form of communication for non-emergent situations.
Yeah, and that's Microsoft Teams. But
Oh yeah.
cool. Wanted to ask the last one?
Well, with like you were talking about these like emergent situations, which are like exceedingly common in your industry, obviously. How do you approach making like decisions when there's uncertainty or you have incomplete information from other like doctors you're working with or other people on your team?
Yeah, so when there's incomplete information, right, you gotta close that loop, because it could be life and death in terms of miscommunications. So we call the physician's office or the hospital and get their chart notes, and so that we can personally review all the data before we make a decision. And that'll include not only the office notes, but any labs that were completed, any imaging studies completed, any medications given, so that you can make a decision on the whole picture instead of a partial picture.
Okay, and then this is kind of like a second part or almost, like if you could like give us an example of a difficult decision that significantly impacted or like changed your team or organization. Maybe having to do with incomplete information or something like that.
Sure. Well, I made a decision pre-COVID to build a new clinic in a new location, and the old clinic was actually in a really good location in terms of visibility, in terms of traffic count. We would always be getting X number of patients from just cars driving by and seeing my clinic. And so the incomplete information was that I was, given a pretty good opportunity to purchase property on a different location. Did not know the true traffic count or what the conversion rate would be of cars driving by as to whether or not I would obtain new business that way. But I made a decision to change locations, build a new clinic building, and it actually turned out to be the right decision.
Would like to hear.
Wow. Yeah, that's pretty cool. Because I know like it was that space, it was very visible.
Very visible, yeah.
Yeah, so that's cool. So then what's your approach to handling conflicts between team members?
So usually what we'll do is sit down with a team member that has the conflict with the culture of our clinic, of my clinic, and give them an opportunity to tell us why they did what they did versus what we expect from their performance and behavior. So the first time that there's a conflict that's significant, it's a verbal warning. But if they repeat the error or they have another issue that is a conflict to the company culture, then we sit down with human resource and we give them a first written warning. And that will be repeated up to the third written warning, which is then the employee will be let go if they keep repeating the mistakes.
And then how does HR kind of like play a role in your company, your team? Do they do any management, or kind of just there when they need it? I'm guessing they handle a lot of back-end admin work too.
Well, I would just say that I have a clinic full of employees that have a lot of drama.
Okay. Yeah.
And I do not want to deal with the drama.
Yeah.
So my HR actually helps tremendously in trying to help my staff through issues that go on outside of the clinic that they try to bring into the clinic, and it kind of clears their mind and knows that, you know, at least the clinic supports what's going on, and we try to accommodate and help our employees so that their performance is not affected in the clinic.
Cool. Joe, I wanna.
All right, so yeah, how would you describe the culture of your organization, and what role do you play in shaping it?
Sure. So when we onboard our employees, right, we tell them that my motto, right, is care you need when you need it. And I always try to tell my staff members that when a patient comes in, they're feeling ill, they're not doing well. And so we have to give them that empathy of them being in a place where they will get help. I also try to implement a red carpet service for my patients, where it models the Four Seasons model, where if a patient is asking one of my employees a question, that they will be present, they will answer the questions and or direct them to where they need to find the answer, and a lot of hand holding. So I think that's important.
Yeah, what do you mean by hand holding? Like walking them through it?
Either at the front desk with answering questions about insurances, about what costs are and things of that sort, to having a coffee kiosk where patients can settle their nerves by a cup of coffee. If they need to go to the bathroom, that they're escorted to the bathroom instead of just instructing where to go.
Okay.
And then kind of you touched on this a little bit with what you guys do with teams, and then a little bit with the last question about your guys' culture. But what steps do you specifically do to ensure that new hires or new people that you're integrating into your practice also represent the company culture and project that out, obviously, as their hospitality?
Yeah, so good question. It all starts with the onboarding process. Our onboarding process is, first of all, a lot of paperwork, but through it then, a lot of the culture of the clinic is planted within the first day, such as, we have them see a lot of videos on one, HIPAA compliance, which is a big deal in terms of, medical care, where, information that occurs within the clinic has to be kept within the clinic and not be broadcasted to the community. We have videos on how to be safe. We have videos on, in our clinic, right, bloodborne pathogen exposures, where they are given scenarios where they might either stick themselves with a needle, or the patient with a needle, and how to avoid that. And if it does occur, what to do. And then we're also, giving the employees a roadmap as to, when to ask for help if they are in a dangerous situation where they sense harm to themselves, what to do, how to call for help, and how to make sure that you can avoid that situation as well.
All right, good. So, how do you handle performance issues while maintaining morale?
So it's not necessarily like a culture, collision of like an employee isn't working well with other people, but like they're just maybe underperforming.
Sure. So, I use Skinner's operant conditioning method, which is, that intermittent rewards have a huge impact on performance.
Yeah.
And so throughout the month, I'll treat my staff to, say, blizzards from Dairy Queen.
Yeah.
Or I will get them donuts or some sort of goodie during the day. I'll pass out Starbucks cards to employees intermittently to keep the morale up and to have them keep focusing on their jobs.
Okay. Very nice. And then I guess you kind of already answered this last question, but to balance like autonomy and authority with employees, how do you assure accountability? Because employees, they probably get to a point where they're pretty proficient at their jobs and they think they're autonomous, but if they are overconfident in that, they might become a little too headstrong and not take authority well. So
yeah, well, the good news in a clinic such as mine is that there's a lot of checks and balances, right? And so, if we start with the providers, right? I personally will review chart notes probably on a daily basis. I will also ask them to present to me cases that are of emergent situations so that I know that the care and the workup is done correctly. In terms of the medical assistants or the nurses, right? It's obvious if they're not performing to their tasks because there's going to be patient complaints.
Yeah.
We're not going to get our labs done or our EKGs performed, and so then the providers are set question, okay, why wasn't this done? And make sure that it does get done. And then if that keeps happening, then they are, verbally warned, and then, written warnings occur right after that. In terms of my front desk, right, we have a statistical analysis, which is called the first pass, which looks at how accurate they input data on the first try so that it passes enough to get to the insurance companies. And then on the back end, in terms of billing, I look at, on a monthly meeting, look at accounts receivable, the AR days, which tells me how well they are doing in terms of charges and collections.
Cool. So good feedback system with just, actions taken and corrective measures.
Yes,
Wonderful.
absolutely.
Well, that's all the questions we've got for you today, but
Great.
We appreciate your time. And
Yeah, thank you so much, Dr. Will.
thank you for
Yeah,
doing
you're
this.
very welcome, guys, and good luck
thank
on
you.
your project.
Thank you.
I appreciate you.
Okay.